Good afternoon, everyone. I'm Rochelle Squires, the Minister of Families, and I'm pleased to be here today with Dr. Atwal, our Deputy Chief Provincial Public Health Officer, to discuss two things that are on the minds of a lot of Manitobans right now: summer and childcare. As you know, on May 12th, Public Health made the very important decision to move kindergarten to grade 12 schools to remote learning in the cities of Winnipeg and Brandon. Subsequent announcements were made that saw more schools and communities across our province move to remote learning, which was extended through to the end of June. Families, along with the early learning and childcare sector, were greatly impacted by these announcements, as some no longer had access to their childcare, and centres were seeing a change in their daily numbers of children to be cared for. I want to thank both Manitoba families and the ELCC sector for making these important sacrifices that were essential to reducing the spread of COVID-19 and lessen the burden on our healthcare system. Je tiens à remercier les familles manitobaines et le secteur de l'apprentissage de la garde de jeunes enfants d'avoir fait ce sacrifice important qui ont été essentiels pour réduire la propagation de la COVID et réduire le fardeau de notre système de santé. As the school year is coming to a close, many have been wondering, what is the plan for the summer when school is out across the province? I would like to take this opportunity to announce that because of the efforts we have all made to reduce the spread of COVID-19, Public Health has advised that beginning July 1st, school-aged children will be able to return to their childcare programming. This includes full-time childcare for July and August. In addition, we know that many families make great use of our summer day camps provided by various organizations across the province, and that in many cases, parents rely on these day camps as a secondary type of childcare for the summer months. That is why I'm pleased to announce that these day camps will also be permitted to operate beginning July 1st. At this time, there are no changes to the cohort sizes for licensed childcare facilities, and we would like to remind facilities to continue implementing the measures outlined in the Early Learning and Childcare Practice Guide to ensure a safe and healthy environment for children and staff. Summer day camps will reopen with cohort sizes of 20 children, as outlined in the health order, and are reminded to put the measures outlined in the ELCC practice guide in place to ensure safe services. We know that a parent's ability to work may be dependent upon the availability of childcare, and I would like to acknowledge Manitoba's early learning and childcare sector and all Manitobans for their flexibility to adapt to the advice from our public health officials as we continue to navigate this pandemic. Thank you, and I'd now like to turn it over to Dr. Atwal.
Thank you, Minister Squires. Good afternoon. I'm Dr. Jas Atwal. I'm Manitoba's Deputy Chief Provincial Public Health Officer. Today, there are 4 additional deaths due to COVID-19. I want to offer my condolences to their family, friends, and loved ones. The current 5-day COVID-19 test positivity rate is 8.3% provincially and in Winnipeg. As of 9:30 a.m. today, 189 new cases of the virus have been identified. As the Minister noted, school-aged children will be able to return to their childcare programming that will be permitted for some families beginning July 1st. Summer day camps for youth 11 and under will be permitted to operate as options for families whose children do not attend licensed childcare facilities. We're providing this information today to allow sites and parents to begin planning. More details will follow next week as new public health orders are finalized. This will help alleviate some of the pressure on licensed childcare facilities. Manitobans have done a lot of hard work in following the public health orders. Parents have had to navigate the pandemic while juggling caring for their children, and I applaud them for their efforts during this challenging time. Our vaccine rollout continues, with thousands of doses being delivered each day, and COVID-19 cases and test positivity rates are decreasing. This is allowing us to open these important services again. Starting on Monday, Data on possible COVID-19 transmission and acquisition sources will be added to our weekly COVID-19 reports. Transmission data includes information on places that cases have visited and may have transmitted the virus to other contacts when they are communicable. This period is 48 hours before the development of obvious symptoms in the case and until the case is classified as no longer infectious. Acquisition data includes information on places where people visited during their incubation period. This includes the 14 days before they develop symptoms. The data for both acquisition and transmission is collected through interviews to determine possible exposures. In some cases, the possible exposure may be very clear, such as if the person was a close contact to someone who tested positive or if they acquired COVID through travel. However, in other cases, there may be multiple possible exposures to COVID-19 for an individual. These cases are determined to be community-acquired or unknown acquisition. In those scenarios, we try to learn more about where the person was to see if trends in acquisition or transmission show up. For example, the person may say that they went in for 4 different settings during their acquisition period. They may have gone to work, went to church, visited a friend, and went to the grocery store. This makes it difficult to confirm a specific location, date, or time where someone got COVID-19. But if many people report visiting a similar place, that trend is worth exploring. This data will help highlight those trends. Starting on Monday, this data will be available at www.gov.mb.ca/health/public health/surveillance/reports. Our case numbers are headed in a good direction, and our vaccination rates are increasing. However, we continue to see deaths due to the virus and continued strain on our healthcare system. Despite the declining case numbers over the past week, we expect hospitalization and ICU numbers to remain high. I want to address the increased number of Delta variants of concern on the dashboard today. Teams have identified a technical issue, among other issues, prevented lab results from being transmitted electronically into the Public Health Information Management System. The cases in the data today were manually entered on June 17. This has not affected how public health has monitored or managed each one of these cases, and work is now underway to address the technical issue. The B16172 variant, or the Delta variant in particular, has the potential to be more transmissible and have more severe impacts on individuals. As I noted last week, work is underway to include the effects of this variant in our modeling. We will continue to watch the Delta variant carefully to make sure we are aware of the possible impacts of this variant in Manitoba. This is why our path to reopening is cautious. If Manitobans continue to get vaccinated as soon as possible, and both first and second dose rates continue to increase, we are likely to win the race between these new variants and the vaccine. Slowing in our progress or failing to adhere to the public health orders in this critical time risks a resurgence of cases and puts our path to one great Manitoba summer at risk. Sunday is Father's Day, and unfortunately we are not able to celebrate the way we want. Now is the time to show your dad how much he means to you by not putting him at risk or those he loves at risk. Under the current public health orders, gathering indoors is prohibited. You're able to gather outdoors. On private property, you can have 5 visitors from no more than 2 other households, in addition to those who reside there. Or in public outdoor spaces, you can have up to 5 people in total. While the orders allow you to gather, I strongly encourage you to continue to limit your contacts. Right now, it's up to all of us to take steps to protect each other. Everyone needs to get vaccinated. If you got your first shot on or before May 23rd, you are eligible to book your second shot. It is our collective action, not public health orders, that will bring cases down and help end the third wave in Manitoba. Practice the fundamentals, continue to stay at home as much as possible, and get immunized as soon as you can. Thank you, and now we could take questions.
Thank you. A reminder to our reporters on the line, you will have 1 preliminary and 1 follow-up question. Up first this afternoon from CTV Winnipeg. Stephanie.
Hi there. Has the Delta variant been considered in the province's reopening plan? We've just seen, obviously, how it's spread in other countries. So just curious whether that's something that's being considered with the summer reopening.
Yeah, so obviously we are looking at that Delta variant. We're sequencing our samples because at present there isn't a screen for the Delta variant as well. So we are sequencing the samples that don't screen in for another type of variant. So we're gathering that information. We're gathering transmission events. We're gathering acquisition events related to that as well. It hasn't been incorporated into the modeling, so that work is underway. So once that's incorporated into the modeling, we'll have modeling information as well. But our vaccine strategy with double dosing and the markers we want for that, the targets we have for that, we have taken the risk of the Delta variant into play here. But, as more information comes out, we're going to continue to adjust our thoughts on the risk related to the Delta variant and incorporating that risk into our reopen strategy as well.
And in terms of the summer day camps, I believe it was mentioned 20 children can attend, I guess, each type of camp. I'm not sure what the numbers would look like in a non-COVID year. Does this mean that some children still could potentially not have, or some families, I guess, not have access to either the childcare or the day camp?
We want to make as many options available for Manitoba families, particularly Manitoba families who need to have childcare arrangements for work purposes. And so we are just restricting the cohorts to 20. So if a day camp can operate a few cohorts with 20 per cohort, that would be permitted.
From CHVN, Taylor.
Hi, good afternoon. Minister Squires, you briefly mentioned something about child care license changes. Can you just expand a little bit more on that?
Child care license. Sorry, can you elaborate on your question?
Yeah, when you were talking about child care reopenings, you mentioned something about child care licensing.
So I just mentioned that there's no change in the cohort sizes for our licensed childcare facilities, and that remains at 30 children.
Thank you. And Dr. Atwal, how is this Pfizer slowdown going to affect reopenings in Manitoba?
How is the Pfizer rollout, did you ask?
Yes, the slowdown.
Yeah, so with the slowdown in the Pfizer vaccines coming in, we have limited it's going to impact the ability of, the 12 to 17-year-olds to get the Pfizer vaccine. So there's a bit of a bump in the road. We faced many bumps in the road as well. Our vaccine uptake on first dosing is over 70%. We're at 70.6%, for the population 12 plus, and we're at 22% for 2 doses as well. So we're going to continue to monitor the situation. We incorporate all this information into orders and how we look at the orders and what we would be able to do. So again, all that information is taken into account.
From the Winnipeg Free Press, Julia.
Hi there. Minister Squires, I understand, kids are going to be able to go back to daycare and camps. In the case that there are outbreaks or something of the like at these facilities, will those be publicly announced? Will the public get a chance to know if there are outbreaks at camps or child care facilities?
So we've worked very closely with the sector to ensure the safety of the students and the participants, the children, as well as the staff, and we'll continue to do that. And public health has provided significant guidance in regards to the safety. And I'll perhaps turn it over to Dr. Atwal to talk about what happens if there's an outbreak at one of our facilities.
Yeah, so whenever an outbreak occurs, a public health investigation is done. We're aware of the cases that occur there, and pending that investigation, we have to look at risk and what the risk is to the population that's there and also to the population that might be not there or to the general public. So if announcements are required, public health will lead that. The same would apply to day camps as well. So when these day camps do operate, they would be having to have cohorts, so cohorts of 20 that can't interact with other cohorts. This is for daytime hours as well, and these are young kids, so 11 and under. So if a case ever develops there, we would do our public health investigation and take the steps that are required to ensure that we mitigate risk in relation to spread of the virus and to manage the situation as well, and to provide that information if needed to the public.
Okay, thank you. And I guess, you said, Dr. Atwell, that you're expecting hospitalization and ICU numbers to stay high for the next little while. Is there any insight you can give as to when the models are predicting that will start to dip?
Well, they are dipping right now. So I think over the past 4 weeks, when you look at our a 7-day rolling average of cases, on a week-to-week basis, they're dropping about 20 to 24%, depending on which week you look at. Our hospitalization and ICU numbers, obviously, we always talk about a lag time between case generation and when someone presents in a hospital or ICU. So those numbers have peaked and they are coming down. They don't come down as fast as case numbers, though. So when people enter an ICU, some people in ICU end up being a long stay. So I think about 25% of people in ICU end up being there longer than 2 weeks. So our numbers will still, remain relatively high on the ICU side. On a percentage basis, they are decreasing, but again, not to the same extent as case numbers. The same applies for hospitalizations. A lot of times, some individuals have quick hospitalizations, a day or two or a few, but some end up being there longer, weeks. And so again, those numbers will decline, but not at the same rate, not at the same percentage basis compared to cases. So on a week-to-week basis, I don't think it's unexpected to see somewhere between a 10% drop in both those on a rolling average. And I think we'll probably continue to see that, barring an unforeseen circumstance.
Thank you.
From Global News, Marnie.
Good afternoon. Dr. Atwell, we had a group of doctors this morning saying that schools could be at risk of closing again in the fall if we don't continue with strict public health orders and enter a fourth wave. Can you give us an idea of what you're going to consider when it comes to sending kids back to school in the fall, and what our numbers would need to look like in order to do that safely?
Yeah, so we've gone through a number of waves with COVID already, and we're going to continue to see COVID. COVID isn't going away. We have variants now, variants of concern. There's, less vaccine effectiveness to the newer variants that are out there. Are we going to see a wave 4 or a wave 5? I think that potential exists. And, it exists because COVID is going to be endemic. So meaning it's not going to go away. It's always going to be here, something like influenza, right? Something like what's called RSV or rhinovirus. We're going to have this on a regular basis. There's going to be some seasonality likely associated with it as well. So our biggest advantage here right now is we have a vaccine, and we have a vaccine that's quite effective. It's quite effective at 2 doses, even with the variants. And we need to really push that vaccine, which we have been. We need people to get that first dose, and they have been stepping up, and we need people to continue to get that first dose, and then we need people to get that second dose when their time comes. So if we're able to get enough of the population vaccinated, that mitigates the risk of a wave. We'll still have a wave, but it might not be a tsunami. It might not be a really big wave. We want that wave to be nice and small so our system can manage it, and that is the goal. It's really hard to predict, 2 months down the road, 2.5 months down the road as well. So I think right now, the messaging should be, the focus should be, let's get that vaccine, right? If you got your first dose, great. Book your appointment for your second dose when it comes. If you're vaccine hesitant, talk to your primary care provider, talk to the nurse practitioner you deal with, talk to public health, and work through that vaccine hesitancy and try to understand what the vaccine means. These are the same healthcare providers who are vaccine hesitant. They still get healthcare. These are the same providers you trust with your cancer diagnosis. They're the same provider you trust with your diabetes, your high blood pressure. If you get in an accident, you trust these individuals to help you out. Trust these same individuals to provide you with good vaccine advice.
Okay, thank you for that. And just kind of on that message, on that note, what message would you want to send to parents who have that concern? They've had their kids at a school for a while now. They're hoping their kids can have maybe somewhat of a normal summer, but then they're worried about the threat of a fourth wave and how that could impact school in the fall. Just how would you want to address parents' concerns?
I think, I'm a parent. I've got 3 kids in school. I'm a bit concerned about it as well. But again, I think this comes down to getting that vaccine, and if if things go well, if things go as predicted, and we get that really good first dose vaccine uptake, second dose vaccine uptake, then I don't see an issue with schools starting up or being open in the fall time and continue to be open. So I understand some of the anxiety surrounding it. Don't be anxious about it. Do your part. Get that vaccine. If your kids are eligible, if they're 12 and up, book them appointment, get that vaccine as well, and continue to practice the fundamentals.
From the Brandon Sun, Kimberly.
Good morning, or pardon me, good afternoon. This question is for Minister Squires. Minister Squires, what measures are going to be taken for the day camps and the daycare centers with regards to supporting the public health orders, for example, masking up and sanitizing and so on? Can you give me some insight on that, please?
Thank you for the question, and we've worked very carefully with the sector and public health and providing them with all the information that they need to ensure that they can operate their facilities and keep their children safe and the parents and all the staff that work there safe. We have increased the number of PPEs that we've sent out to the sector, 1.1 million pieces of equipment per month is being sent out to the sector, along with we've upgraded the level of the grade of the mask to level 3 medical grade masks for all our workers in the sector, and we are going to be sending out a circular reminding them of the information that they need so that they can operate their facilities safely and keep all their kids safe and allow them to come in and have fun and experience the best of this summer, even though we are still in the midst of a pandemic.
Thank you for that. So will the children be required to wear masks, for example, at the day camp?
The requirements have been laid out that the younger children do not, and the staff certainly do, and I'll defer to Dr. Atwell to talk a little bit more about those protocols in place.
Yeah, so, we worked with guidances for a number of sectors in the past. A lot of them are, have run day camps. They ran them last summer as well. We've had programs running throughout the year. Yes, they aren't running right now, the day camps, but they will be able to open again. So we have guidances for them. And obviously on the mask situation, whether it's indoors or outdoors, masks are mandatory in some indoor settings, right? In indoor settings, not outdoors. But we'll have other guidances potentially for them as well. I don't think much would change, but there are those who are exempt from wearing a mask as well indoors, pending age and pending certain medical conditions as well. So they would have to follow the orders, and that's all addressed in the orders, and those orders obviously will be changing to allow for this activity to happen.
From CJOB, Skylar.
Hi, Dr. Atwell, Minister Squires. Thanks for your time this afternoon. It's pretty clear that I think at this point that we're going to reach that first vaccination target of 70% first dose coverage and 25% second dose coverage by Canada Day. Some people are suggesting it could happen as early as, the beginning of next week. The public health order expires on Friday. Are we looking at potentially a Saturday lifting of restrictions?
Yeah, so from a public health standpoint, it isn't just about vaccine uptake when we look at the orders, right? There's a whole bunch of indicators we look at: acute care system capacity, there's test positivity, there's vaccine uptake, how that vaccine uptake is within the entire province as well. So, we're having discussions about that. We're going to have discussions this weekend about it and next week. It's too early to discuss that at this point. I mean, the orders do expire on the 26th at 12:01, but when more information is available on the orders and on the direction that we're going to take as a province from a public health perspective and an orders perspective, that'll be available next week.
And then just on that note, Dr. Roussin last week talked about a 5% test positivity rate being, somewhat palatable when thinking of reopening. What other numbers are you going to need to see in some of those other metrics? Some people would suggest that opening things back up while nearly 24 Manitobans are out of province for intensive care would, seem a little backwards.
Yeah, I mean, right now we have, 20 individuals still out of province. We haven't had any new admissions out of province today as well, so that's good. Hospital numbers are still high. We got 258 Manitobans hospitalized, whether in province or out. We've got 80 in ICU, 60 in Manitoba, and 20 more outside of the province. Again, those numbers take time to come down, and those are just a couple of indicators that we look at. We look at new admissions to ICU, new admissions to hospital, test positivities take into account, test volume, case number generation, what population's getting the cases by age, by health condition. There's all these other things that we look at as well. So we're not fixated on one specific number per se, like what you mentioned in relation to 5% test positivity. It takes it's one piece of information that we use in relation to the orders and the restrictions on Manitobans. So again, it is early to speculate. A lot could happen between now and 7 days from now, 8 days from now. But we are having those discussions. We're looking at all that information. We're working with our acute care system as well in relation to this. So again, when more information is available, and it will be available next week, we'll provide that to the public.
From the Winnipeg Sun, Scott.
Hi, good afternoon to both of you. Dr. Atwell, how realistic is it, if the Delta variant modeling shows something different than what our current, the modeling you guys showed last week, I'm wondering how realistic is it that restrictions will be lifted at that 25% kind of mark set out in the 4-3-2-1 reopening plan. How realistic is it that that'll happen if the Delta modeling shows something different?
Well, I mean, this is a bit of a hypothetical, right? We still have to run the model with the Delta variant information and variables put in, and that is being developed right now. We have to take a look at that information. We know our Delta variant numbers because the samples are being sequenced, right? So we have that information. We have, we have a case and contact management in place where we gather that information. Most of the Delta variant cases are linked to travel or to household transmission, and we had a cluster as well related to that as well. So, we have a good idea of exactly how much Delta variant is here right now. And now, coupled with that, we have to think about our vaccine uptake, right? So our vaccine uptake does prevent Delta variant from causing a symptomatic infection. And it seems like the Delta variant also prevents hospitalizations in ICU, even if you develop symptoms. So there's other variables to look at there as well. So that's a single dose, and a double dose has a much more profound effect. So, we're learning about some of this information from other jurisdictions that have a lot more experience and information and data related to the Delta variant. So again, all that information will be taken into account. And you're right. I mean, we have to look at the risk there, but it's too early to look at that risk right now because we just don't have that information. We would anticipate, for sure subtle changes. So this isn't a wide open reopening of everything on July 1st either, or when we meet that target on the vaccination side. So we still have to take a look at all those other indicators. We have to look at what we're going to be able to do from a risk perspective. And I mean, whether it's subtle changes, I'm sure we'll have subtle changes. I don't know if we'll have profound changes, which is, I think, what people are expecting anyway, because we weren't looking at profound changes right off the bat. So again, it's challenging to talk about what the orders might look like, where we're going to be at in a week's time. And again, we're going to review all this information, and there's lots of information to review, including the Delta variant, including experiences in other jurisdictions, to come to some of those decisions, and that'll be available next week.
All right, thanks for that. And my follow-up is, can the province, even if we hit this 75-25 thing or 70-25 thing, and our numbers show what they show, if we still have 15, 20 people outside of the province in other ICUs, and this is again another kind of hypothetical, but is it possible that those July 1st, even if they are subtle reopenings, won't happen because there's still, obviously a big strain on ICUs?
Yeah, first, I do want to thank our neighboring provinces for helping us out with the ICU situation and taking on those clients. We had 57 people who went out of province. 7 passed on because of their ICU admission related to COVID. We had 30 people repatriated back, and we still have 20 out of province. We know when you get into an ICU, you're sick. There's always a risk of death going into ICU. That number is roughly, 30% when you're dealing with COVID. Coupled with that, when you get into ICU, some people have a very short ICU stay. Some people have a midterm ICU stay, and then we have those long-term ICU individuals who are in there longer than 2 weeks. If we still have people out of province, we're not using that as a single indicator saying we can't do anything either. I think we still have to look at, are we having new ICU admissions, and are we still sending people out of province? What's our hospitalization rate? What's our test positivity rate? What's our case numbers? What's the risk in Manitoba as well? So again, it's one of the indicators we look at, but we have to also understand some of the, the metrics and the variables behind that one indicator, but we have to incorporate it into a whole package as well. So again, that will be taken into account when we look at the orders. And again, once information is available, we'll provide that to the public.
From CBC Radio Canada, Charles.
Hi. So, like some of my colleagues said, 11 physicians called today for a better reopening plan with the growing threat of the Delta variant. So, what do you think about their letter? And do you think you will listen to them and maybe adapt your plan to focus more on case numbers and test positivity rate?
Yeah, I think I've kind of talked about this question a few times already. But again, we're going to look at all of our variables. We're going to consider the Delta variant. We're going to look at not just one or two variables. We're going to look at acute care system capacity. We're going to look at ICU capacity, hospitalizations. We're going to look at case numbers, test positivity. We're going to look at how much Delta variant is out there and other variants of concern as well. And we're going to look at other jurisdictional information as well. And there's a whole gamut of information that we look at, and we synthesize that information and put it together, and we review it with our stakeholders as well internally, including the acute care system. And then, once we have more information, we'll provide that information to the public, and that would be available next week.
Thank you very much, Doctor. And Minister, a new Winnipeg Free Press and Probe Research poll shows that your government approval is decreasing significantly. What are your thoughts on that, and what message does it send to your government?
We know that it's been a very challenging time for Manitoba, for Manitobans, and that is why today I'm happy to be here to provide a bit of a framework for reopening some childcare centres and some of those summer camps, so our kids and our families can have as best of summer as possible. But undoubtedly, it has been a very hard time for Manitobans, and we certainly sympathize with all Manitobans who have struggled through this pandemic. And as a government, we're here to help facilitate and get back to a new normal as soon as possible.
From CBC Manitoba, Jill.
Good afternoon. Dr. Atwell, why is there a Pfizer slowdown or shortage, and will the province hold or prioritize Pfizer for 12 to 17-year-olds for a second dose since that age group can't get anything else?
The Pfizer shortage, again, vaccines procured by the federal government. I believe there was a supply issue there on that side. A vaccine task force would have more insight or a lens on that. In relation to doses and availability, again, the vaccines are interchangeable. Once your dose is available for those 18 plus, whether it's Moderna or Pfizer, get that product. The Pfizer is the only one that's recommended at this point and authorized for those 12 to 17. So again, the first doses are there. Our supply issue is a short-term issue from what it sounds like. So there should be enough availability for second dosing when that second dose time comes for those 12 to 17.
And then with respect to the Delta variant, how long on average is it taking to sequence and confirm a sample? And why did it take more than 2 weeks for the province to confirm the first death related to Delta?
So when a test becomes positive, a screen is done, and if those screens show up, let's say an alpha or a beta variant, then that's reported out. Once that screen's done, if something doesn't screen in for one of the screened in variants of concern, then we send that off for sequencing. So that sequencing could take 7 days time, 9 days time from when the sample was taken from the person, because the screen has to happen first, and then it gets sent off for sequencing. And the screening could take 24 to 48 hours, depending on where it's being done. So there's a bit of a time lag there as well. Now, the second question you had there was related to the death. So when someone has a COVID infection, obviously they get swabbed, they get screened, and then if that screen is negative for a variant of concern that we could screen for, then it gets sent off for sequencing. And then if that person subsequently passes on, what happens is that there's a bit of an investigation there done and a review done to determine if that case actually did succumb related to a COVID infection or not. So that just takes time. And we've had the same experience before as well when we dealt with this as well. So it just takes a bit of time for that to happen, because that review has to happen, typically with the physician reviewing the case and the case file and gathering that information and providing that information.
Our final reporter this afternoon from the Canadian Press, Steve.
Oh, hi, Dr. Atwal. I know you've been asked this quite a few times. I'm going to try it from a bit of a different angle. The letter signed by the 11 doctors today, they spoke about it today, and some said it would be completely irrational to ease restrictions as of July 1st because they don't see the indicators, although they're falling, they don't see them falling to the point where it would justify reopening as early as July 1st. So what do you see in the numbers at this point that would warrant even some easing of the restrictions?
Yeah, so, we work with our acute care system. We talk to the leads on a regular basis. We sit at tables with people who represent all of these doctors as well. And we have discussions. We have discussions with the acute care system on a regular basis as well. Again, when we're looking at these indicators, our case numbers are decreasing. The percentage of individuals who are vaccinated with one dose keeps increasing. The oldest individuals, those percentages are still increasing as well. So the ones who are greatest at risk of entering an acute care facility are on a week-to-week basis, there's more and more of those individuals getting their first dose. And now we're seeing a lot more of them getting their second dose as well. So that's just going to continue. Again, the more individuals that get vaccinated, the less risk there is of transmission, the greater chance there is to prevent transmission chains from occurring as well. So again, we're gonna review all that information that we've spoken about already, and we're going to continue to make the best decisions for Manitobans. And obviously, we always take into account that acute care system as well, and the capacity of the acute care system in our decisions.
And the plan obviously has not been finalized, but what was floated out there in general terms in the 4-3-2-1 reopening plan talked about 25% or greater opening capacity for businesses, services, and facilities. So I'm not sure what facilities means, but it raises the possibility that movie theaters and casinos and museums and facilities that have been closed may reopen. Do you see the public health order changes being that dramatic? Or when you say they're going to be subtle, is it something more subtle that would not include reopening facilities that are currently closed?
Right. So, we've spoken about this as well. So we're going to take into account all that information. The plan isn't a direct correlation with once we hit this target, everything's able to open at 25%. We still have to look at risk. We still have to look at other indicators as well. And we have to look at priorities for Manitobans. So again, all that information will be taken into account, and we'll review it, and then we'll come up with the best advice for Manitobans. And again, that information will be provided next week.
Thank you, Minister. Thank you, Doctor. This concludes our media briefing.